Hi, my name is Deborah Loney. I am an otorhinolaryngologist here in Loxahatchee, Florida. That word is quite daunting and intimidating, really, if you think about it, but it breaks down quite easily. Oto is ears, rhino is nose, larynx is throat, and gology is the study of, otherwise known as an ENT, or an ear, nose, and throat doctor. We treat diseases of the head and neck, both medically and surgically. I love ENT. It is a wonderful, wonderful specialty. Why? ENT is unique in my mind because, for one thing, we treat everyone from newborn babies to people that are over 100 years old. We treat males and females, and we address diseases of the ear, nose, and throat, head, and neck. So that incorporates everything from diseases of the inner ear, middle ear, external ear, to sinus problems, to nasal problems, to throat problems, thyroid, parathyroid, neck masses, hoarseness, reflux, vertigo. There's a wide range. On a given day, I can see all of those and more. So that keeps it interesting, it keeps it exciting and engaging. How do we get to this point? It's a lot of studying and it's a lot of hard work. So I went to school for a very, very long time. I was just discussing that with my sons. After college, I went to medical school at Stanford, and then and medical school for me was 5 years because I did a fellowship, although it could have been done in 4. I did a research fellowship, which added a year. It also helped pay for it. And then I did 5 years of residency at the University of Iowa. So yes, it is a long time, but like a long plane trip to somewhere exotic and wonderful, once you get there, you forget how long the ride took. It's fantastic. I have lots of flexibility. That's another plus for ENT. You can have a practice that is focused in any way that you want. If all you want to do is nasal sinus stuff, you can focus on that and probably avoid doing a lot of call at the hospital. If you want something more in depth, you can do a lot of head and neck cancers, which of course involves sicker patients and more time in-house at the hospital. If you want a practice that is not surgical, there is a medical aspect of ENT where you can just practice the medical side of things. And in terms of surgical breath, you can do operations using anything from a microscope and putting in the tiniest of ear tubes all the way to removing a throat cancer and putting a chest flap or a piece of someone's leg into their neck to perform reconstruction. So the range is incredible. Another wonderful thing about ENT is that we're always changing. Sinus surgery specifically has gone from something where we used to use a hammer and chisel and crack into someone's sinus to where we use things like these scopes and look inside. We use navigation to be sure of our surroundings. And now it's gone to balloons where you don't even cut necessarily. You go into a sinus cavity and expand the opening using a balloon, which can be done in the office. And that is something that has come about more recently. So ENT is always changing. Certainly with COVID, we've had to be very careful, use masks, goggles, and stay safe. Thank God I have not gotten it. I have been careful. And even though we do operate right here in Ground Zero, I think with care and extra precautions, one is able to practice safely. I did want to make a caveat on the pathway. I have 2 boys. I chose to stay home with them for 7 years and then come back and practice. It can be done. It is not easy, like nothing that you really want. It's not easy. It took effort, but it's possible. So whether you're a female and you think you want a family and maybe children, don't let that put you off from a surgical subspecialty. On a typical day, I don't have a typical day. There are no typical days. I'll give you last Monday, for instance. I was supposed to have patients in the office all day. That was the plan. Well, I got a call Monday morning. There was a patient with a problem. I actually have pictures, who he sneezed and his dental appliance got stuck in his throat. So I was called to the ER. I made an assessment. I actually used this, a flexible laryngoscope. It entered through his nose and went down into his throat so that I could make an assessment. And indeed, his dental appliance was stuck. When I looked down his throat, I saw this. So that is a very unusual sight, because here's his base of tongue, his epiglottis, and lo and behold, 2 teeth with the appliance plastic for his palate attached. So generally we don't see teeth when we look down into someone's throat. This was there. It was above his glottis, so it was above the opening into his airway. That means that the anesthesiologists, wonderful as they are, would not be able to intubate him. They would not be able to put a breathing tube in to breathe for him. So what we ended up doing is we made a plan together where they would give him inhalational gases to put him to sleep. And then once he was asleep, I was able to use a laryngoscope, hold open his throat, and use a grasping device, a forceps, to remove the dental appliance. Now, the trick is the dental appliance had hooks. So these sharp hooks were hooked onto his epiglottis. So I had to manipulate it without causing trauma to the tissue so that I was able to remove it. And it even got more interesting because a piece of the appliance had broken off, and this piece had gone astray. So we got this piece out. We're like, yay, but we noticed from the pre-op x-ray that this piece was missing. We had to bring in fluoroscopic guidance, which is in the OR imaging, to take a picture and verify where this missing hook was. It was up and behind his nose. So then we had to use different instruments to open up his nasopharynx and use a curved hemostat to remove it atraumatically from that area. Had we not located that missing piece of hook and he was woken up, he could have sat up and this could have gone into his airway and it could have caused his death. So it was important to not only be attentive but to be meticulous and careful and make sure that we got out the entire piece. So of course I had to cancel my morning cases that were scheduled, and then in the afternoon I saw patients as usual. So in a typical afternoon I will see a whole range of patients, from little kids all the way to patients in their 90s. Typically the older patients tend to have dizziness problems, balance problems, hearing loss certainly, and sometimes hoarseness as well. With the children you're more likely to see things like tonsillitis, ear infections, hearing loss, speech delay. And with the middle-aged people, it can be any of the above, as well as certainly thyroid problems such as nodules, parathyroid problems with hypercalcemia or parathyroid adenomas, neck masses that can be anything from congenital to inflammatory to infectious. I saw a young lady who had enlarged lymph nodes, and there was concern that it might have been carcinoma. Her nodes, I believe, were 4 to 5 centimeters in size, which is quite large for a cervical lymph node, and her brother had had a history of Hodgkin's lymphoma. So understandably, the family was quite concerned that she may have the same thing. So subsequently, we did blood work, and she also ended up with an excisional biopsy, and thankfully, it was lupus. And her case is kind of a clear intersection of kind of the medical part and the surgical part. Her symptoms were kind of vague, autoimmune type symptoms with itchiness, joint aches, and some swelling. But she also had this tenderness in her neck with these enlarged nodes. So it was important to do the blood work to evaluate her from an autoimmune standpoint, but it was also important to get a lymph node to make sure that it wasn't a malignancy, especially in light of the family history of Hodgkin's. So a typical day, as I said, is not typical. No 2 days are the same. And even patients with similar problems present differently and are treated differently depending on their other existing factors. I wanted to talk about, I guess, the cost. Medical school is very expensive. I imagine now the tuition can be upwards of $60,000, $70,000, $80,000, and that is a lot of money. The good news is a lot of the schools, my school, Stanford, gave me 50% tuition was covered just because I did research. And I think a lot of the schools do that type of thing, but additionally, there is money available depending on your parental level of income You can have assistance in terms of loans, grants, and aids. And I believe millions, if not billions of dollars go unclaimed annually because people don't know about them. So the important thing is, if this is your dream and this is what you want to do, pursue it. And you will find a way and people will find you. The other thing I wanted to say is that it doesn't have to be a straight path. I did not know that I wanted to do otolaryngology originally. I thought I was going to be an eye doctor. So from undergrad, I was doing research at the New York Institute for the Blind. In college and in medical school specifically, I did neurobiology research on rods and cones in the eye. I did patch clamping to study the cyclic GMP-gated channels. Did all this eye stuff, but when I actually got to it and I did a clinical rotation in ophthalmology, it was not what I wanted. I thought, gee whiz, this is not for me. And I continued to do rotations, rotated in ENT. It worked out that I got to do a lot of hands-on and I loved it. And I can say that I'm as excited about ENT now as I was then as a resident. And whatever it is that you choose, you want that fit to be right. So that when you go to work, you are so engaged and you enjoy it to such a degree that it's not like you're at work at all. So income, everybody always wants to know about that. It's the bottom line. You don't want to starve and work this hard. As any type of physician, you are not going to starve. I think as a surgical subspecialty, you're going to tend to do a bit better financially than the primary cares. One, because you're paid for surgery. Two, you're paid for procedures in the office. And I guess when you do scopes and these types of things in the office, that tends to pay better, I think, than a routine visit. So I think the average ENT salary is in the $300 to $400 range. Certainly you'll have loans and such to pay back, but you can make a very good life. The other thing is that you can, depending on how you want to practice, you can certainly be part owner of a surgery center, which I am. Additionally, you can find other ways to diversify your income if that's what you're interested in. But just being a straight ENT, you still will do very well. And you won't be jetting around in private planes necessarily, but you will certainly be able to have a lifestyle that you can enjoy. In terms of work-life balance, particularly for women, I think that's a real consideration because at the end of the day, if you're mom and your wife, you're still mom and wife, even if you work a 14-hour day. I wouldn't say I found a perfect balance. I have managed. I have my 2 children. As I mentioned, I did take 7 years off. I homeschooled. I still cook and bake. Yesterday I made blueberry scones. I made coconut bread. I made a coconut curry shrimp dish with some rice to go with it. You have to balance. So I wasn't on call last weekend, so I could do more. I'm on call this weekend, so I do less. I also run and bike. I went on bike rides both days this past weekend. I went for a run. Sometimes I get up early in the morning and I bike. You can do things, and I travel. I love to travel. Of course, COVID has put a dent in that, but because you manage your office and your practice the way that you want, it gives you the flexibility such that if you are careful and judicious, you can still take trips. I have traveled all over. I've been to Korea, New Zealand, Iceland, Costa Rica, all over the Caribbean, all over Europe. You can travel. You can be athletic. I run 5Ks. I bike. It's just a matter of balance. And so some days maybe I won't see as many patients because I know that I have other things that I want to do. Perhaps I maybe won't take as much call because I have other things I want to do or I plan to be out of the country. It's a matter of balance. And obviously if you're intelligent enough to get through medical school and residency, you can figure out a way to balance it. You can have a fantastic life and love what you do and still be a dedicated mom, wife, sister, daughter, and wear all the hats that many of us wear. I think ENT is it. It certainly is it for me. Thank you.